Good evening, class. My name is LaCuria Lacey, and today I will be teaching you about sickle cell anemia. So, first, let's get started. So, we'll be talking about sickle cell anemia by LaCuria Lacey. Okay. So, first, let's tell the difference between sickle cell and between a normal cell. Okay. So, as you can see, that a normal cell, as you see right here, is round shaped, and a sickle cell is like a sickle. I like to think of it as like a crescent, like a moon shape. So that's the difference between a sickle cell and between a normal red blood cell. So the sickle cell is crescent shaped and the normal cell is round shaped. Okay, so and that's sickle cell versus normal cell. Let's go on. Okay, so let's discuss what sickle cell is. Okay, it says sickle cell anemia is one of a group of disorders known as sickle cell disease. Sickle cell anemia is an inherited red blood cell disorder in which there aren't enough healthy red blood cells to carry oxygen throughout your body. Normally, the flexible round red blood cell moves easily through blood vessels. In sickle cell anemia, it says the red blood cells are shaped like sickles or crescent moon shapes, as I was saying in the previous slide. It says these rigid, sticky cells can get stuck in small blood vessels, which can slow or block flow and oxygen to parts of the body. So if we're not getting oxygen and blood to the body, that is a problem. That becomes a problem. So it says there's no cure for most people with sickle cell anemia, but treatments can relieve pain and help prevent complications associated with the disease. So sickle cell isn't curable, but some of the symptoms is like pain. Sometimes you have temperature. Like we have meds for those, but the disease itself is not curable. Let's talk about some of the sickle cell symptoms. It says signs and symptoms of sickle cell anemia usually appear around 5 months of age. So as an infant, that's when you can have sickle cell. It starts around that age. Normally it does. It says these vary from person to person and they also change over time. So let's take a look at some of the sickle cell symptoms. Okay. It says you have anemia. Let's see. It says sickle cell break apart easily and die, leaving you with few red blood cells. Red blood cells usually live for about 120 days before they need to be replaced. But sickle cell usually die in 10 to 20 days, leaving a shortage of red blood cells. It says without enough red blood cells, your body can't get enough oxygen, causing fatigue. So you can have fatigue because your body isn't getting enough oxygen. Like we said before, what's going on is there's becoming a blockage, so you're not getting enough oxygen and enough blood that's trying to push through. So that becomes a problem. So let's go on. Okay, let's see. Let's see. It says episodes of pain. Okay, periodic episodes of pain called pain crisis are a major symptom of sickle cell anemia. It says pain develops when sickle cell shaped red blood cells block blood flow through tiny blood vessels to your chest, abdominal, and joints. Pain can also occur in your bones. It says the pain varies in intensity and can last for a few hours to a few weeks. Some people have only a few pain crises a year. Others have a dozen or more pain crises a year. A severe pain crisis requires a hospital stay. So that's what we're really trying to avoid. A pain crisis is not a good thing. Really, if you any signs of pain crisis, you need to contact your doctor, go to the hospital as soon as possible. It says some adolescents and adults with sickle cell anemia also have chronic pain, which can result from bone and joint damage, ulcers, and other causes. So once you get towards that adolescence, adult age, it becomes really more serious. That's when the joint pain, ulcers, and other causes usually occur in. So pain crisis, severe pain crisis, we really want to stay away from that. So if that does occur, then you need to be contacting your doctor or getting to an emergency room, because it can also lead to, it can sometimes even lead to death depending on how fast that you get to it. So any symptoms of that, it needs to be checked on. Okay. Swelling of hands and feet, edema. It says the swelling is caused by sickle-shaped red blood cells blocking blood flow to the hands and feet. So that pressure you're trying to get you're trying to the blood is trying to squeeze through there, and it really can't because it's blocked off. So that's you're building up pressure, so it causes swelling to your hands and your feet. So that's another symptom, swelling of hands and feet. All right, let's move on. Frequent infections. It says sickle cells can damage your spleen, leaving you more vulnerable to infections. Doctors commonly give infants and children with sickle cell anemia vaccinations and antibiotics to prevent potential life-threatening infections such as pneumonia. So with sickle cell, is you can get infections easily, especially during the cold time. During the when it starts to get cold, pneumonia season. So this is really a serious problem dealing with sickle cell. So let's go on. It says delayed growth or puberty. Let's read. It says red blood cells provide your body with the oxygen and nutrients needed for growth. A shortage of healthy red blood cells can slow growth in infants and children and delay puberty in teenagers. So, with sickle cell, we have delayed growth or puberty. So, it can affect that. All right, let's move on. Okay. Vision problems. Let's see. Tiny blood vessels that supply your eyes can become plugged with sickle cells. This can damage the retina and lead to vision problems. Okay. Okay, you have signs or symptoms of stroke. This is this symptom is really, I've seen this with people actually. I actually have a family member with sickle cell, and I've actually seen this. So this is a really serious symptom. So let's read. It says, if you notice one-sided paralysis or weakness in the face, arms, or legs, confusion, trouble walking or talking, sudden vision changes, or unexplained numbness, or a severe headache, you should call 911 or your local emergency number right away. A sign of a stroke, the first sign, even if you think you're having a stroke, you need to contact 911 or your doctor. Okay. All right. Medications. Okay, you have hydroxyurea, hydria, and cyclos. It says daily hydroxyurea reduces the frequency of painful crises and might reduce the need for blood transfusion and hospitalization. It can also increase your risk of infection. Don't take the drug if you're pregnant. Okay. You have Andari. It says this drug for treatment of sickle cell anemia. It helps in reducing the frequency of pain crises. So as we were saying, you won't eliminate the sickle cell, but it can help with the symptoms that you have. Okay. We have Adakvia. It says this drug is for treatment of sickle cell anemia. It's given through a vein. It helps reduce the frequency of pain crises. Side effects can include nausea, joint pain, back pain, and fever. Okay. And you have your normal pain relieving medications, over-the-counter medications. It says Voxelotor. This oral drug is to improve anemia in people with sickle cell disease. Side effects can include headache, nausea, diarrhea, fatigue, rash, and fever. Okay, and these are just some medications. Of course, there are other medications, but these are just some that a lot of people come in contact with, common medications. And of course, you have your pain relieving medications, which are basically over the counter medications you can get at your local drugstore. Okay, this is pain management with sickle cell. It says drink water or other fluids. It is very important to stay hydrated. Even the littlest amount of dehydration can cause a problem. So, yeah. So if you're exercising or any type of sport or whatever, it's very important to stay hydrated because a little bit of dehydration can really cause a problem. So with sickle cell, it's important to stay hydrated. It says heating pad or warm bath to the bone pain, joint pain, relaxation techniques, yoga, and distraction, listening to music or whatever other things that you may like to do. Okay. Healthy foods. These are some healthy foods that you can eat during if you have sickle cell anemia. It says you can eat leafy green vegetables, beans, nuts, eggs, fish, lean meat, soy milk, orange juice, and tofu. So those are just a few. There's other things, but those are just a few that's really important and that you can have a good diet that you can have with sickle cell. Okay, it says sickle cell crisis. Now, previously we had talked about sickle cell pain crisis, which is really serious. The first sign of sickle cell pain crisis, you should really contact your doctor. You should call 911. Sickle cell pain crisis is really a really big deal. So let's see. It says sickle cell patients should avoid many things such as smoking, alcohol, use extreme heat, cold air, and swimming. Okay. So let's see. These are some questions that we can answer right here. It says, what should sickle cell patients avoid? So as we go back, let's read. What are some things that sickle cell patients should avoid? Right here it says they should avoid smoking, any tobacco use. And tobacco use is not good with dealing with sickle cell. Alcohol use, extreme heat, cold air, and swimming. So that answers the first question. Okay, what age does sickle cell crisis start? So when we first began this, we taught that sickle cell crisis. So I meant the sickle cell anemia starts. So sickle cell anemia starts in infancy. So you're usually tested. The doctors usually determine this in infancy. 5 months, 4 to 5 months is usually when it's determined. So about 4 to 5 months in infancy. So it says what food is good for sickle cell. So let's go back to that slide. Okay, and here we read the healthy foods. Let's go over it again. It says you get leafy green vegetable, lettuce, okra, just things like that. It says beans, nuts, walnuts, things like that. Eggs is really good. Fish, lean meats, soy milk, orange juice, that's really good, and tofu. Okay, so let's go on. How to manage pain crisis. So let's go back to that slide actually and talk about that a little bit more. Okay, this is how you manage pain crisis as we talk. Drink water or other fluids. Like we said before, it's very important to stay hydrated. The littlest dehydration can cause it's a big problem. It can really cause a problem. So we want to stay hydrated. Get those fluids. Drink water, plenty of water, especially if you're playing any type of sport or constantly in the sun. I remember during what was it? It was band camp. It was band camp, and we had a band member who had sickle cell anemia. He had to have more breaks than we all had because he had sickle cell, and he could be easily dehydrated. So he had to have more breaks than we had. So because the slight bit of dehydration is not good at all. So he constantly had to have either a longer break or more break periods than we had to get him some fluids in. Because of course we was out there in the hot sun, hot weather, sweating. moving, exercising. Okay. Another thing would be heating pads or warm bath. Now the heating pads is to relieve that pain from your joints, your arms, put them on your legs, back, anything like that. So that's what we use the heating pads, or warm bath can just help those muscles, help your joints out. So that's another thing that you could do. Relaxation techniques, listening to music, yoga, trying to take your mind off the pain or whatever. I use sleep as a relaxation technique, so hey, it might help. So, like we said, yoga, listen to music, taking walks. It's good to move around, move your joints, move your legs, bike rides or anything like that. So that's really good. Distractions, relaxation. It's kind of, it all kind of is the same thing. Those two are kind of the same thing to me. Listen to music, taking walks, coloring, painting, or doing other activities that you enjoy doing. Don't swim. We talked about that, so that's not good. Okay, so let's see this question. All right. And true or false, is sickle cell a crescent shape? It kind of got cut off here, but sickle cell is a crescent shape, so that is true. So that answer would be true. Sickle cell is a crescent shape, and a normal blood cell, you know, it's the normal circle shape. And okay, let's talk about your normal interventions. It says, we'll just read a few of these. It says you can monitor the respiratory rate, depth, use of accessory muscles, and areas of cyanosis. These are indicators of adequacy of respiratory function, or degree of compromise, and the effectiveness or need for therapy. Osculate and note the presence or absence of breath sounds and avenue sounds. It says development of atelectasis and stasis of secretions can impair gas exchange. Monitor vital signs and note changes in cardiac rhythms. Compensatory changes in vital signs and development of the arrhythmias reflect effects of hypoxia on cardiovascular system. Okay. It says regularly assess level of consciousness. That's very important. It says brain tissue is very sensitive to decrease in oxygen. Doing the assessment may be an early indicator of developing hypoxia. Assist client in turning, coughing, deep breathing exercises. It says promote expansion of chest optimally, mobilization of secretions, and aeration of all lung fields. This also reduces the risk of stasis or of secretions and pneumonia. Okay, interventions, it says evaluate patient's tolerance to activity, limit activities within patient tolerance, assist with activity of daily living and mobility as needed. Now this, it reduces the metabolic requirements of the body, would reduce the oxygen requirements. Okay. It also says intervention, teach and demonstrate the use of relaxation techniques, guided imagery, deep breathing exercise, and visualization. Relaxation decreases muscle tension and anxiety, and hence the metabolic demand for oxygen. Encourage adequate fluid intake, 2 to 3 liters a day within cardiac tolerance. It says adequate intake is necessary to provide for a mobilization of secretions that prevent hyperviscosity of blood occlusion. Perform and assist with chest, side physiotherapy, intermittent positive pressure breathing, and intensive spirometry. It says patients with SSD are prone to pneumonia, which can be potentially fatal because of its hypoxic effect of increasing sickling, mobilizes secretion, and increased aeration of lung fields. Okay. Okay. This is your diagnosis. How do they diagnose this? A blood test can check for the defective form of hemoglobin that underlies sickle cell anemia. In the United States, this blood test is part of routine newborn screening. So as a newborn, you get tested for this. But older children and adults can be tested too. In adults, a blood sample is drawn from a vein in the arm. In young children and babies, the blood sample is usually collected from the finger or the heel. The sample is then sent to a laboratory where it's screened for defective hemoglobin. Okay, now let's answer some of these questions, class. It says, which one is a sickle cell and which one is a normal cell? As we talked, we said that sickle cell is going to be that moon crescent shape, and the normal cell is going to be the circular shape, okay? Says what is the difference between a sickle cell and normal cell? Normal blood cell, see, healthy sickle cell. See how it's obstructed and that it's blocking. So pressure. How to manage pain crisis as we talk how to manage pain. Excuse me. Um Walks, relaxation techniques, distractions as we talk about that. So let's go ahead on. All right, class, and that is the end of the sickle cell anemia. Thank you for listening.